Hi everybody, this is Amy, also known as Daydreamin' Mom, and I wanted to do this follow-up video to let you all know how I'm doing with my bilateral mastectomy recovery. I'm 2 weeks post-surgery, and I'm doing really well. A lot of the majority of the pain has gone away. I'm still a little sore under here. I've had, some sore, pain in my sternum and just right above, like right under my, bra line, like right where the top of the rib cage is really sore. My doctor told me that's because of the surgery, and it will heal. That pain will heal. So if you're having similar pain, if you're 2 weeks out and you're like, oh, why is my sternum hurting? Why does my rib cage hurt? Is that normal? Is that okay? Is my expanders crushing my heart? Have no fear. My doctor told me it's normal. If you're really concerned, call your doctor. Tell them what you're experiencing, get that reassurance. It's always best to check. But, really I'm on the mend. I'm doing better. I'm still really flat. It's been really weird, to go from being a 42 double D to, nothing. It has been a comfort to me, though, with the reconstruction. I know not all women really care to do the reconstruction, or, if you're nervous about doing reconstruction, I just want to say, do what feels right for you. Listen to your instincts, talk to your doctors about your options. I was a little nervous. Ignorance is bliss. There's pressure, there's a tightness around the chest, and experiencing that while recovering from the mastectomy, I think kind of prolongs, the pain. I'm pretty sure that if I had just had the mastectomy, 2 weeks out, I might be a little more healed by now. Like, I might not be in as much pain. I'm sure I would still have the sternum pain. I'd still have the ribcage pain. It still might feel a little sunburny under here. But I wouldn't have the pressure. I wouldn't have the tightness, I don't think. I don't know. If you've had that experience, feel free to, comment. Feel free to share those thoughts. If you just had a mastectomy and you do have pressure and tightness, please share that, because I don't know. I'm assuming that I'm experiencing that because of the expanders that they put in there. And if you're wondering what expanders are, there's no metal involved. I've had people ask me, what's it like having metal in your chest? And there's no metal. There's, it's not like metal like you would think it is. Like if there's metal, it might be like where the valve is. My doctor did use this little magnet today to find the little valve where they inject the fluid into the expander. I'm pretty sure that's the only possible thing on the expander, though, that has that. When they showed me the expander, it just looks like an implant, not a pretty like silicone or, saline implant, but it has like this like mesh, and then it's like an implant, it's a temporary kind of an implant, but it's more like kind of a sac, like I don't even know, like a silicone kind of like sac that when they put it in you, they fill it with just a little bit of saline solution right after your surgery. And then I'm 2 weeks out, and I just barely had my first fill up today. And if you're wondering what that's like, for me, it really wasn't that bad. He found the little valves. I wasn't even thinking about that, like that there would be valves in there. It made me feel like, I don't know, like a robot being worked on or something. It was kind of a funny experience, but it really didn't hurt that much at all. He just like put a little mark where the valve is. He numbed the area really good. I got a shot that numbed, the breast area, and then they injected the fluid in. And on the right side, I really didn't feel like anything. Like, you do not feel the fluid going in because it's going into the expander. It's not really going into your body. I did feel it like rise a little bit, but that didn't hurt at all. It was just kind of like, whoa. The left side, for some reason, though, has been like, it wasn't even the side that had the cancer, but my left side has been more tender through this whole healing process. Um, so when he did the Philip on that side, there was just a little bit of stinging that lasted for just a few seconds, but it went away. It wasn't that bad. So future prospect, having to go in next week, for another Philip, and the week after that for another Philip, until I'm ready to have my permanent implants put in. I'm not worried. And I have an anxiety disorder, so that's really saying something. I'm not scared to go in for my Phillips. They really aren't that bad. It is really nice to see myself healing, though. The scars, they're really big. I'm not gonna sugarcoat it. After bilateral mastectomy, I literally have, like scar from, here all the way, over here. And on this side from here, like all the way over here. And for some reason on this side, I also have a lateral scar. I'm not entirely sure what that's about. Just maybe, I don't know. Oh, it's not this side, sorry. Mirror. This side, the left side, I have a lateral scar. That was the larger breast, so I'm wondering if maybe they just had some difficulty getting to all the breast tissue, so maybe he had to make another incision, but whatever. My cancer is out of me, and that's all that matters. Having big, beautiful, voluptuous breasts, I don't care. Maybe you care, but I don't care. I just want to be alive. I just want to be here to raise my beautiful children and, to see them grow and to be here for them and support them and be here for my husband and my family, and my friends, and be here, to serve and help, in the community and my family. I've got a lot left to do. And so, getting that breast cancer diagnosis knocked me off my feet, took my breath away. As soon as they told me that, I just said, take them off. Take them off. I don't want this. It was like, get the cancer out of me. And I had a 6 centimeter area of breast tissue that was inundated with cancer cells. So first they said 9 millimeter, but after the surgery they said 6 centimeters. I don't really know how much of a difference that is, but whatever, it's gone. So yeah, just grateful for that. It's really surreal also right now going through this with the coronavirus pandemic going on. I have to admit, it was a month ago I was diagnosed with cancer. A month later, the whole world is shut down because of a pandemic. Yeah, mind-blowing. I'm kind of like, why did I stop taking that Xanax? Why did I stop taking that oxycodone? Like, why did I stop taking the painkillers and the anti-anxiety the doctors gave me 3 days after surgery? It's like perfect opportunity to just tune all this out. But no, I like being lucid. I need to be here for my family. Not going to tune out. So, just stay strong out there, everybody. Stand sure. I'm making these videos to share my experiences because I want to help bring hope to anyone else who's facing this, especially during this time of crisis, to let you know that, you can do this. You can do this. You can fight your cancer. You can survive. And I want to let everybody know out there too, there's a lot of people who are very vulnerable right now. Cancer patients, people who've been going through chemo, people who just finished some kind of big surgery. We're all immunosuppressed, and we're at really high risk, for this coronavirus. I'm 40 years old, but I just had a bilateral mastectomy. That's a big surgery. I am immunosuppressed right now, and I'm not sure when my immune system's going to be back up to par. I've had a post-surgical fever of 100.5 for like 2 weeks now. So, I know my immune system is still working things out. So I just want to let everybody know out there, please, be sensitive to the fact that there's a lot of people, of course, the elderly, we all know that. The seniors in our communities are at really high risk. People like, me and people who have been going through chemo or are recovering from chemo. Just so many people who are immunosuppressed and are really relying on everybody to be responsible and to, just be careful out there, and do your best to protect each other and, to fight for each other. And yeah, so prayers to you. I'll post again soon, let you know how my recovery's going. I'll share what I can. If you have any questions, please feel free to, shoot me some messages. I'd love to answer any questions you have about, my experiences with breast cancer. I would really like to help bring, some hope and comfort and peace, with the knowledge that I've gained from this to anyone I can. So I'll talk to y'all later. Bye.